The evolutionary basis of antibiotic resistance.
Meet Sally. Sally doesn't feel well because she has a sinus infection due to bacteria colonizing in her sinuses. Meet the bacteria that have invaded Sally's immune system. Luckily, Sally's doctor has prescribed her a common antibiotic, amoxicillin, to combat the infection. Let's take a closer look inside Sally to understand how this antibiotic will help defeat those pesky bacteria.
Seatbelts, everyone!
So what is happening with this bacterial infection before Sally takes her prescribed antibiotics? Here we see the various bacterial populations conducting their normal cellular processes. Unencumbered by antibiotic interference, these bacteria are able to continue living. As time goes on, surviving bacteria will undergo the cellular replication process known as binary fission, and as such, will produce genetically identical offspring. How does the introduction of the antibiotic alter the diversity of the bacterial populations colonizing within Sally?
As it turns out, not all bacteria are created equal. Some are better equipped to evade the effects of a particular antibiotic, and as such are able to survive and reproduce more effectively than competing bacterial populations in the presence of that antibiotic. As we see here, when the antibiotic is administered, only the green bacteria are resistant to the effects of the antibiotic, and in the end are the only population able to withstand the treatment. This bacteria will continue to produce genetic clones, ultimately resulting in a population comprised entirely of antibiotic-resistant bacteria. Antibiotic resistance can be conferred in many different ways. Let's look at a couple examples of the mechanisms bacteria use to defend themselves from antibiotic attack. Some bacteria, like those seen here, are equipped with lipopolysaccharide, or LPS, in their cell wall, which acts as a physical barrier preventing the chemicals of the antibiotic to penetrate the bacteria. As we see here, when the antibiotic is administered to these populations, the only populations to survive the treatment are those with the LPS layer that they can use to protect themselves. When these colonies reproduce, the resulting genetic clones will also express an LPS layer and will likewise be resistant to the specific antibiotic treatment. Not all bacteria have an LPS layer to protect themselves, but have still evolved different mechanisms that have helped them confer resistance to antibiotics. Here we see how bacteria can use efflux pumps to evade the effects of antibiotics. Efflux pumps are systems that allow bacteria to take in the antibiotic only to pump it back out into the extracellular space. Just as with the LPS bacteria, these bacteria are quite capable of evading the antibiotic, and in the end are the only survivors of the attack. Now that we understand how antibiotic resistance evolves and some of the mechanisms by which bacteria confer antibiotic resistance, let's briefly review what we have learned. When bacteria reproduce by binary fission, the resulting descendants are genetically identical to the parental bacterium. After being exposed to a particular antibiotic, some of the bacterial populations being targeted will be better equipped to handle the treatment and thus will be able to survive and reproduce, while those less equipped will not be as successful. Those that survive will produce genetically identical offspring, and as a result, the offspring will express the same resistance to that antibiotic. While there are many mechanisms by which bacteria can confirm antibiotic resistance, some include incorporating an LPS layer in their cell wall to provide a physical barrier to protect from antibiotic effects. Others may express different protective systems such as efflux pumps, which prevent antibiotic substances from affecting a cell by pumping the harmful chemicals out of the bacterium and into the extracellular space.